streaming live. I'll start sharing the link with everybody.
Hi everyone. I hope all of you are keeping safe. So there's this little presentation I prepared for to guide everyone how to the path to Australia, because I know there is a lot of dilemma about going abroad and pursuing dentistry abroad. So I don't know how many of you are aware, but Australia has a direct licensing exam which you can clear, and you directly become a licensed dentist in Australia, and you can start practicing in Australia. So there are some very good prospects if you wish to move to Australia and practice in Australia. So let me just brief you up about how is the process of getting into Australia. So first is, why should anyone go to Australia? It's a very beautiful and a very friendly country. I've been there a couple of times, so I can vouch for it. Plus, it has the best quality of life according to World surveys. So basically, Melbourne has been coming on top of the chart, #1 for the most best quality of life since quite many years. And 1 in 4 dentists is a migrant. So you will find a lot of migrant dentists who you can share your life with, you can share your experience with them. So they'll always be there to look out for you and help you in the process. And another plus is, which most of us really would like to hear, is that average annual salary for a dentist in Australia would somewhere go up to be 70-80 lakhs per annum. And this I'm talking about for a fresher dentist, as in right after passing your ADC exam, when you get into the market to practice as a dentist, then the annual salary which you'll earn would be approximately 70-80 lakhs per annum. Now, of course, the cost of living also goes high when you live in a country like Australia, but it is not, I mean, you'll still save a lot of money and live a very good life, even after, spending on all that life. So basically, what is the process? So basically, first of all, it's a direct licensing exam, which I've already told you. The plus is, it's a very clinically oriented exam, as in those who've been practicing for some couple of years in India and who have been very clinically oriented, who have seen all kinds of variety of patients in their clinic or in colleges. It would be very relevant for you to give the exam, and it would be comparatively easy. Because I feel that most of the practitioners who've been, who've been out of college since quite some years find it practically difficult to get back to studying, because they are scared that how will I study anatomy, physiology, biochemistry. So this is a big relief for them, that it is a very clinically oriented exam. There are no questions from anatomy, physiology, biochemistry. Of course, there'll be clinically relevant questions, but it will not be the bookish questions like, which nerve passes through this foramen, or, the path of artery or whatever. It's not going to be that kind of questions. It will be all clinically relevant questions. And now it has 3 parts. So now we'll discuss these 3 parts in detail. So, so basically, what do you need? What do you need to get into? What is the eligibility for someone to apply for the ADC exam? So first is, the dentist must hold at least a 4-year full-time university dental degree, which all dental schools in India are already doing. So it is very, there is no way that you can get disqualified in this criteria if you want to apply to Australia. Then another is that you hold a registration or a license in either your home country or the country of training. So for us, the home country and the country of training would be the same, which will be India. And all of us are licensed practitioners. All of us have a registration. So these 2 criteria are fulfilled by any Indian dentist. Now there are 3 parts, like I already told you. First is to get your documents verified, which is known as the initial assessment. And then it's the part 1, which is the theory exam, and part 2, which is the practical exam. Now, coming on to initial assessment, basically it's a document verification process in which you have to send all the documents, which have to be notarized by a public notary. So you don't have to send any original documents, like in case of Canada exams. So here there's another relief which you will get because your original documents will stay with you. This process takes about 2 to 3 months. So, which is a fair enough time. Meanwhile, you can always prepare for your exams. And the fee for the initial assessment is 610 Australian dollars, which is approximately 30,000 INR, which is again doable. And the validity of this initial assessment is lifelong. Although there are presently, the Australian Dental Council is contemplating on making the initial assessment valid for 5 years, but they haven't still come up with a, definite timeline for the initial assessment. As of now, it stands valid for lifelong, right? So now coming on to part one. So this is a theory exam, and another good thing about this is that it's conducted in all the major cities of India like Hyderabad, Bangalore, Chennai, Bombay, Delhi, Noida, Gurgaon, all major cities, Calcutta, all major cities are centers for the exam. So you don't have to travel. So the initial, you'll save on some money here also, unlike the Canada and the UK exams. So this is another relief if you want to apply for the Australian exams. Now there are 4 papers over 2 days. So the first day will have 2 papers and the second day will again have 2 papers. So this is how they've divided the papers. Each paper is for 2 hours, and and the exams are conducted in March and September. However, this year the exams haven't been conducted because of the COVID situation, and the March exam was cancelled, and the September there's still no notification about the September exam. So we don't know whether it will be conducted in September or not. However, as it is, if you are getting into the process right now, your initial assessment would take about 2-3 months. So as it is, you will only be eligible by next year, March. And I think by then the situation of this COVID-19 would definitely settle down. So I don't see a problem there. And so this exam is conducted by Pearson VUE. And like I already said, the exam centers are all major cities of India. Now the written score is only valid for 3 years. So within 3 years, you have to clear your practical to be able to, get licensed as a dentist in Australia. And the fee for this exam is 2,000 AUD, which is approximately 97,000 INR. And you save a lot of money because you're not traveling to Australia to give this exam. So now the subjects, how it's divided into 4 papers. So first is conservative dentistry and endodontics and dental materials. So basically it's anyone who is probably an endodontist or who has all the basic knowledge. So we have to keep in mind that the exam is very graduate level. It's not the level of a postgraduate. It is asking for very basic understanding of the subject and how you can correlate things and come to a diagnosis or a treatment plan. So it is a very clinically oriented exam. I'll keep emphasizing it because this is where most of us will feel relieved about. Because someone who's a fresher, BDS fresher, would have all the clinical subjects very clear in their head because they'll be all freshly read subjects. So it will be easy for them. Plus for the clinicians who've been practicing since quite some time, again, this would be an easy exam. So, and the part 2 will have prostho, that is removable prosthodontics, which will be RPD as well as complete dentures, fixed prosthodontics and implantology. So this is the paper 2. So this paper 1 and paper 2 will be conducted on day 1. So you will be over with both the papers on your first day. Now second day we will have paper 3 and paper 4. Now paper 3 will have oral medicine, oral pathology, oral surgery, dental emergencies, pharmacology and infection control. So infection control is a major bulk of the paper 3 because this is what they really emphasize on. The infection control part is it's a notch up, which takes their practice also at a level high. So infection control makes a bulk of paper 3. Now paper 4 is pedodontics, periodontics, orthodontics, radiology and public health. So you've seen yourself that there are no basic subjects like anatomy, physiology, biochemistry, pharmacology. Although pharmacology would be there, but only the clinically dental relevant questions will be there, like about bisphosphonates, about candida albicans, antifungals, and antibiotics, analgesics. So very clinically relevant questions will be there, even from pharmacology. They will not ask you about antiviral drugs, or about anti-malarials and all that. No, that will not be asked in. They expect you to have very basic knowledge as a dental graduate. So this anyone can study these subjects and pass this exam. So now each paper has 80 questions. And now another thing is scenario based questions. Now there are about 12 to 13 scenario based questions which have about 5 parts each. So they will give you a situation, like suppose there's a sports person and he's training and he takes a lot of juices, and now he's having sensitivity. So it should strike you that we are talking about erosion in this case, because he's having a lot of energy drinks and a lot of carbonated drinks. And so this is and now they'll ask you a lot of questions regarding this scenario, like what should his juices be replaced with, what kind of problem do you think does he have, the diagnosis, or what diet plan, do a diet plan for him. So it will be very clinically relevant. The scenarios will be very clinically relevant. Or suppose they'll give you a patient with a medical history of hypertension or any kind of bone diseases. So it should strike you that he might be on bisphosphonates. And so how will it change your treatment plan and etc. So this is how they test your knowledge. They test how you can apply your knowledge to the questions. So it is a very application based exam. And then there'll be about 15 to 20 multiple choice questions, which will be a direct questions. So even they are very easy and very relevant questions to the dental practice. So there's nothing to worry about part one. Now the passing criteria is that you have to pass all 4 papers at one go. It cannot be like you pass 2 papers and you giving 2 papers next time. That is not the case here. You need to pass all 4 papers in one go. Only then will you be given a pass in the part 1 exam. So they usually grade the exam. This is according to the percentile. So A, B, C grade are pass grades, and D, E are fail grades. So basically, according to how everyone performs that particular, when you appear for the exam, how people perform in general, that will decide the passing percentage and passing percentage and how you will be graded. So I mean, it also so mostly it will be about 60%. 60% if you are able to manage, you'll mostly pass all the papers. So basically, this is how you need to study. You can't focus on only one particular paper and expect to pass the exam. You need to give equal emphasis to all the 4 parts to be able to get a pass in the overall exam. So now coming on to part 2, which is the practical exam. Now it occurs throughout the year. Earlier, it was happening twice a year, but since 2018, July 2018, they are conducting it all through the year, as in they keep opening the application periods for different written candidates, and accordingly you have to keep applying. But exam center is in Melbourne, Australia. So for this part 2, you will have to travel to Australia. So it's conducted over 2 days. So there are 2 parts which are conducted over 2 days. You have a total task of 16. You have total 16 tasks which you have to complete. And the fee for this exam is 4,500 AUD, which is 2.2 lakhs. And probably it will take you another lakh to travel to Australia to and fro. I think I traveled in about 78,000 rupees to and fro, that is. So even if we take it on the upper side, 1 lakh, so probably it will take you 3.2 lakhs. So your exam probably can be completed in 5 lakhs. So this is a very reasonable exam that ways as well. So now let's talk about the breakup of the tasks which you will be required to do in your part 2. So there are technical tasks, which will be 3 preparation based tasks. So there'll be a crown preparation, there'll be a cavity preparation, and there'll be an endo access preparation. So there'll be 3 preparation based tasks and 3 restoration based tasks, which will be an amalgam, complex amalgam restoration, a composite restoration, and there'll be a temporary crown fabrication. So you will have to make a provisional crown on your crown preparation, which you've already done in the preparation based tasks. You'll have to fabricate a provisional crown on that. So this is the technical tasks which come in the exam. Now this is the first day. So first day you'll have to complete all 6 tasks over a period of 6 hours, and they give you a half an hour break in the middle, lunch break. So there you can go into the candidate lobby and you can have your lunch and then come back and finish your tasks. So this is day one. Now day 2 is clinical skills task. So basically there'll be 6 communication OSCE in which they'll give you a scenario. Either they'll ask you to formulate a treatment plan for a patient, or they'll ask you to come to a diagnosis by taking the relevant history. So basically there'll be 6 stations, and there'll be 6 examiners who will portray as patients, and there'll be a scenario on the screen which you'll read, and you'll be given 3 minutes to think of all the relevant questions or how you want to go about making the treatment plan. And so in this you have to keep in mind the medical history of the patient, or you need to ask all the relevant questions to come to a diagnosis, or you'll have to manage the concerns of the patient. So basically this is how they expect you to do the communication OSCEs. And then the 4 skilled OSCE in this again. And so these communication OSCE, each of them you get about 10 minutes. So 3 minutes you get to plan, and then 10 minutes you get to talk and interact with the patient, which is of course the examiner. So this is how the communication OSCE takes place. And then the other 4 are skilled OSCEs. Now they'll give you some tasks to perform in 10 minutes. Like suppose take an IOPA, take a bite wing, or put a matrix band, or administer LA to a patient. They'll give you a scenario on the screen that patient is 8 months pregnant and patient is on antihypertensives or some other drug. So you'll have to choose the right local anesthesia which you would want to administer the patient, the right length of the needle. And so this is where they test you. You should be able to apply the knowledge which you've already studied in your undergrad, or you are applying in your clinical practice. But this is how they test you on your day-to-day knowledge of dentistry. And then the remaining 4 would be those skilled OSCEs. And so this is how they break up the 16 overall tasks for your practical exam. Now, usually there are a batch of 24 in your practical exam. So 12, so they divided into 2 groups, which is 12 and 12. So the first 12 would probably do the technical task on day 1 and do clinical skills on the day 2. And the second group will do the clinical skills on day 1 and do the technical task on day 2. So this is a batch of 24, and this is how they divided into 20 batches of 12. So this is how the part 2 takes place. Now I've covered up all the basic, all the basic of ADC, and I hope you all found it relevant. And if there is any, if you have any questions or anything, you can of course mail me. I'll share my mail ID after the end of the presentation. I've forgotten to add it in the presentation, but I'll put it in the comment section, and you can mail me if you have any queries, or if you want to further find out more prospects, which if you have any questions regarding Australia, right? So now Dr. Hitesh will take over. He's going to discuss the US exams with you, right? So please stay safe. Have a good day. Will Dr. Hitesh take over?
Yes, just give me a few seconds.
Yeah.
Hello. Hi, good afternoon, everyone. I'm Dr. Hitesh Khilnani. So I have been through this process of DDS, basically passed my NBD exams, and but then I decided to drop the plan. Somehow I didn't feel like staying there. Not that it's not a good option. It's an amazing option for everyone, but probably it wasn't right for me. I felt so I came back. Uh, Hence, I started my academy called Dental Academy to train students for who are planning to move to abroad. So basically, if you're planning to practice dentistry in US, you have a process of exams, applications, after which you are eligible to study there. I mean, it's not always you'll have to study, but uh, I would say the easier process or less cumbersome process is passing your exams and then applying there and studying there for 2 years and then getting your license. Okay, so this DDS, Doctor of Dental Surgery, or DMD, Doctor of Medicine in Dentistry, these both are same terms there. Just like BDS in India, you have DDS and DMD in USA. So to start this process, first of all, everybody will have to make up their mind because it's not an easy journey. It's quite a long process. You and a lot of money is involved, everything. So I mean, everyone has to be focused if they're planning to go for this process. How you have to start this? So after you have made up your mind, everything. First thing what we feel is necessary is getting US visa. Visa is most important because you cannot give the exam here in India. So you have to move to US for this exam. I mean, currently it's not possible to go there, but probably after few months, everybody has time to study now. After few months, when flights open, things probably whenever they get normal, you can go and give your exam. So first, most important thing is visa. Visa, you can just go apply for the visa. You can say that you are planning to give the exam, NBD exam. So they'll issue you a tourist visa, B1, B2, based on that. Uh, so once you get your visa, now you are sorted. You have a lot of time because mostly the B1, B2 visa, which they give you is for 10 years. Now you make up your mind. After this, we have your what say This ECE, this is educational credential evaluation. Basically, whatever marks we have scored in our BDS, we have to get them converted to the GPA system of USA, grade point assessment, what they have. So that is whatever marks, whatever percentage we get, they change it to the GPA according to US system, which is based out of 4.0. The minimum requirement which we need to have is 2.0. So if we have passed our exams, everything has been done, 2.0 is not a big deal for anyone. The more you have, the better chances, the better it looks on a resume. So this is the first step. In this, we have to send our mark sheets, our transcript for the course by course evaluation, which is roughly around, I'd say, $165. And we can receive the ECE report within 4 weeks. If someone wants to get it immediately, like say 7 days, then they just have to pay around $40 extra and get it done. It's advisable to get few copies of ECE, because one ECE copy we'll have to send it to the organization JCND, which is basically conducting the exams in USA for students. So one copy we have to send this ECE to JCND, after which we are eligible to sit for the exam. It's like a must requirement, and we have to fulfill this if we want to apply for the exams. So when we get our EC evaluation done, we send it to JCND. I mean, it's advisable to have at least 4 or 5 copies of EC, because they are used later on in the interview process. And once it has been sent to JCND, we are ready to apply for the exam, which is basically NBD Part 1. So National Board of Dental Education exam is divided into 2 parts currently. So part 1 consists of our first year and second year subjects, and part 2 basically has all the third year and final year subjects. I would say excluding general medicine and general surgery. It's mostly it's focused on dental, but it has pharmacology, which is from our second year, included in part 2. So part 1 basically has our first year and second year subjects except pharmac, which are 100 questions for physiology and biochemistry, 100 questions for anatomy, which is actually general. It's not just your head and neck. Majorly the questions which come in the exam are from head and neck, but not entirely. So full body anatomy, 100 questions. Then 100 questions we have on dental DADH and your occlusion, which is very important, and another 100 questions on microbiology and pathology. So the exam is of 400 questions, and it's multiple choice MCQ exam. There's no negative marking, so you'll have to attempt all the, like, it's advisable to attempt all the questions. Once we and there's no criteria basically for marks, so it is percentile based, both the exams, part 1 and part 2. We have to score 75 percentile to get pass the exam basically. 99 or 100 or whatever you score, 75 or above, you will never get to know, because you will just be graded as pass. Below that, if someone fails, then they send them their score. So once you pass the exam, after this, we have to sit for our NBD part 2. So previously what people used to do, moving, suppose someone is going from India, they used to stay there for a few months, give their exams and come back, or probably go for some shadowing, experience their observership, something or the other. But now examination, they have decided, to discontinue these NBD part 1 and part 2. The last date for these exams is 31st October 2020 for your part 1. So if you pass your part 1 before that, you are eligible to give your part 2 till 2022 August. But since the flights are not operating and things are not normal these days, so it's really hard for anyone to go through this process of NBD part 1 and part 2. So what most of us who are planning to move to states now and planning to start with this process will have to this new exam called INBD. It's basically just integrated National Board of Dental Education exam. It's the combination of NBD part 1 and NBD part 2. NBD, so INBD is different from NBD part 1 and part 2. It's probably, you say, like NBD part 1 exam was, conducted on a single day, and part 2 used to be with the clinical subjects for 2 days. Now this new exam will be conducted over 2 days, just like part 2, but it will comprise of all the subjects, basically what we study in our dentistry. Though they say that exam will be much more focused on clinical aspect, and the questions even comprising of physiology, biochemistry, everything, they will be more focused on the clinical usage of those subjects in dentistry. So it wouldn't be random like earlier. For NBT part 1, they used to ask direct questions, why probably this hormone, use of this hormone, or something related to this muscle attachment from where to where, things, basic things, and very direct. But now everything will be structured into the clinical form. Questions will mostly be like clinical scenario, patient is coming, history would be given, and probably radiograph would be there on the screen, and few other details, medical, dental history, all these things, and we'll have to answer based upon all those findings given to us. So a lot of people think that NBD part 1 and part 2 are easier, since we get time to study for all the subjects, and we, like, it's easier because you are not taking on head on all the subjects at once. There are people who think INBD is better because they don't have to keep studying for the exams. They just study for the exam once, clear the exam, and it's done. The only confusion with INBD is it hasn't really started, so we don't know how the exam is going to be, and we'll get to know once it starts this August. So basically, whoever is applying now will have to give this INBD. Exam will have 500 questions over 2 days, and it will be mostly clinical based exam. Like the questions will be clinically based. The passing, same for this exam, marks won't be revealed if you pass the exam. It'll be just be pass or fail. Good thing is, for people like us, they don't have to go there, stay for a very long time. Or even if you are staying for a very long time, you can definitely use that time. Instead of studying, we just give this exam, get our results probably in 2 to 4 weeks, and if we pass the exam, we are ready to say shadow other dentists, see how dentistry is being practiced in USA, and probably help with join some volunteer work there and improve our profile. So in that matter, a lot of people feel that INBD is better than the previous system of 2 exams. So once we have done with our EC, cleared our NBD, now when you pass your INBD, comes this centralized application. I forgot the full form of CAPID, but it's basically a centralized application which is being used, which is of use for everyone. Like, you don't have to go to every website, every university's website separately. So you just upload all your documents, our details, everything, structure, statement of purpose, SOP, LORs, everything has to be entered here. From here, we can decide to which universities we are applying to, we want to apply to, and we can directly send our application from this CAPID to respective universities. So CAPID, I feel, since whoever is applying to CAPID would have passed the INBD and everybody is on the same stand, since they all have on their report sheet pass instead of the marks. So this is one of the most important aspects if you want to become a dentist there and study there in USA. It's a pretty long process to fill this application form. It, we have to, keep a lot of time. We have to work really hard to fill the necessary details, because it will basically ask us everything, whatever we have done. So basically what CAPID is, we enter our basic details. After that, it starts. So we have to fill in about our INBD. We have to even enter our TOEFL score. So TOEFL score, the English, so they have to check our English proficiency, USA universities, before they give us the admission, so that we are able to, if we start studying there, so in clinics, we are able to talk to the patient and take down their history, understand things properly. So TOEFL is really important. So internet-based TOEFL exam has 4 sections: reading, listening, writing, and speaking. So all these sections are of 30 marks out of 120. Uh, it is always advisable to have a score of at least over 100 if we want to, have like what we say, a good standing with our CAPID profile. So once we after INBD exam, we have to give our TOEFL exam. I mean, it's not there's not much to study for most of the people, I would say. We have to take around 7 days to 1 week to 2 weeks of preparation is enough, and after that we can give the exam. And whoever is getting over 100 is ready for the CAPID basically. CAPID cycle starts in the first week of March. Like this year, it has started at on March 5th. It is always advisable to fill the CAPID form as early as possible, because the universities, a lot of universities are on rolling basis. Basically, as soon as they get applications, they start reviewing those applications no matter what the deadline is. If they feel the candidate is good enough for the interview, they even start sending the invites. So if you are applying late towards the deadline of the university, you are decreasing your chances of getting an invite from that university that year. So we start with a CAPID. We enter our TOEFL details, basic details. Then few important things in CAPID are statement of purpose, which we call as SOP. It's really important. Uh, we have to write it in 50 to 100 characters. Basically, we have to tell them why we have studied dentistry, who we are, how like why we plan to pursue this career, why we want to move there, all those things. And it has to be, I would say, from the heart. It has to be written really well. I mean, we just cannot mess up with the grammar or anything, and it has to be in a proper structural form, like starting from your childhood and how we are planning, I mean why we are planning to go there. Everything has to be structured properly in the SOP. So it's actually one of the most important uh, parts of the CAPID application. So after our SOP, we have few other things, like whatever we have, whatever certificates we have to upload them, our ranks, our memberships, even like IDA memberships, or if we have done the BLS course or whatever courses we have done, we have to enter everything just to stand out from other applicants. Because as I told you, everyone has pass on their report card. So you have to stand out from this application. So we have done the TOEFL, all the scores. We have done all our uploaded all our certificates, everything, our poster competitions, presentations, paper competitions, all those things. Even our volunteer works, all these things. I mean, they give high regard to everything, because they are not looking for a person who is just into studies, but a person who is working overall and improving the environment society around him by probably involving himself or herself with volunteer work and all these things. So everything, so extracurriculars, all the extracurriculars are really important. They just, I mean, make us stand out from the rest of the people. After entering all these things, we even have our LORs, letter of recommendations. A lot of universities want us to have at least one LOR from the dean of a college. A lot of people want LOR from our current employer or someone who we are working with currently, or some professor. So most of the universities, they look for three, a letter of recommendation. There are few universities which allow you to even upload one or two more, so basically around making them five, but three LORs are a must, and we should definitely try to get these LORs from someone who knows us really well. Apart from this, I would say one LOR is really important. To one LOR from someone who's practicing in US, or probably a professor in US or a dentist in US, but it's I I mean, they give a lot of weightage to someone who has written you the LOR from USA. So whenever we go to give the INBD exam there, it's advisable to join a preceptorship, basically an observership program at a university, dental college and dental school, basically what they call there, uh, observership, and get a letter of recommendation from a professor there. Or if you are not unable to get a preceptorship, or if it's too expensive and you're thinking of not going through that route, you can always join a dentist, go and shadow them. Dentists usually don't mind there. I personally, for a different experience, I personally went to a dentist who was American uh, there, because I mean, there are a lot of even Indian Americans, but just to see how people are there, or probably I just wanted to have a look on how are they even treating people or things like that. So I had a really nice experience working with uh, people there. So they they used to treat me really well. Whatever I like I wasn't able to understand, they used to stop the procedure, tell me whatever is happening, how things are happening in USA. So they were really helpful, and even the letter of recommendation I got from that doctor was really nice. I mean, we are not allowed to see the letter of recommendation letter, but after I discontinued with my process, I got a letter from him. I mean, I was able to check what was there in the letter. So yeah, so once we are done with all these things, we move on to another uh, part of the CAPID application, which is super important, is the individual university questions. So whichever university we are planning to apply to, uh, every university has their own sets of questions, right? Basic questions: what are your strengths, weaknesses, how you'll fit into the program, if you know anyone from the program, about our research work, about the article reviews, whatever we have done, things we have gotten published. So they definitely ask these things, and trust me, this is one of the most important criteria for them to see how the student is answering his or her questions, and they give a lot of stress on research and publications. So it's always advisable for everyone to have few researches, few uh, publications in the international journals, at least one, I would say, and some review articles. All these things are really important. So once we are done with all these things, we have answered the questions individually. Now we are ready to send the application. We have to make the payment online. We are this CAPID application goes to those universities. Few universities want you to probably send things like separate LORs to them, or ECE transcripts, or all these things, depending on university to university. After this is done, the next part after completing the CAPID successfully and applying to as many universities as you can, comes the interview and bench test examinations. So the people, so basically after reviewing the CAPID applications, so suppose say you have applied in this CAPID application, which started this March. So they start interviewing people, like depending on the university, but they start, the interview process starts around May 1st or 2nd week. We have to go there for the interview, the personal interview, which is most of the universities personal interview is really relaxing. They don't make you feel like it's an interview. They'll just have a nice talk with the student, and it's probably a pretty long talk, pretty long interview. Some even take 40 to 45 minutes or 1 hour discussing things, but basically they just want to see whatever we have, what the way we have presented ourselves, the whatever we have written about us in the CAPID, and all the things which we are mentioning and telling them are correct, and to see whether we are the right fit for their program. So the personal interview, I mean, it's always, it's definitely advisable to, practice few basic questions. Why you want to be, why you want to be studying in that school? Why you want to be a dentist? Tell us about yourself and basic things. Besides the interview, we most of the universities, they conduct an practical exam which is called bench test. In this, the exam is being conducted on the mannequins. The common exercises which they want us to, perform there are class 2 cavity preparation and restoration, uh, crown preparation, PFM, FGC, all basically crown preparations and class 2 cavity preparations are super important, and the restorations, composite and amalgam. Besides these exercises, most of the universities, they focus on these exercises. Apart from these exercises, there are few universities ask us to perform exercises like making an RPD design, or endo access preparation, uh, what we say, temporary crowns, all these things. So there are vast exercises, but the major exercises which they want us to perform there are the class 2 preparation, restoration, and the crown preparation. And there are a lot of universities who are basically just asking class 2 or just crown or a combination of these two. But the good thing is, whenever they send an invite, they tell us beforehand what exercises they will be focusing on, and what exercises they want you to come prepared for that bench test. So these two things are really important. I mean, if we want to start studying there, get admission in the college, dental school there, uh, we need to give a nice personal interview and a bench test. There are few universities even conducting some question. They give you a set of questions to answer. There are universities who just want us to perform not on the mannequins, but just take tabletop the jaws we have and start cutting there. So handheld exercises. And there are a couple of universities like Boston and Rutgers who don't even conduct an bench test. They just conduct a personal interview. So once we are done with this, then the university calls us for the so if they deem us fit for their program, they'll accept letter of acceptance, and basically it's probably the first journey for you to apply for the student visa, convert your tourist visa to the student visa now, and start the journey there. And I would say, about the journey, the college, the dental school program there, most of the universities have it for 2 years. One or two universities conduct it for 3 years, but basically most of the universities have the DDS for 2 years for us. And once we are done with that program, there's a licensing exam depending upon the state where you want to practice. We have to give that exam, and even that exam even for that exam we have to prepare for the ground preparation and class 2, but on patients this time. So these exercises are actually really important for us to learn. So this is basically it about the process and journey to USA. And if you have any questions, you guys are most welcome. And I'm so sorry, I forgot to tell you one thing, that there's this dent pin, which is probably the first step on the ADA website. We have to register for this dental personal identification number. It's basically your Aadhaar card there. So whatever the thing we are applying to, or whatever we are sending out the application, they want us to mention our dent pin number. So it is really important. हेलो, हाँ अब क्या करना है, स्टॉप शेयर करना है क्या? मैंने हाँ सॉरी सॉरी